This is Marcus. He's not yet aware of it, but Marcus suffers from peripheral vascular disease. Our primary focus for this informational presentation will be the nurse's responsibilities when treating patients with PVD. But first, let's take a look at the disease process itself.
Our patient Marcus suffers from peripheral vascular disease. In his case, the problem is arterial insufficiency, but it is important to know that venous insufficiency can occur as well. It is important to understand this because treatments will be very different given what type of problem your patient has. Arterial insufficiency is associated with a diminished blood supply to peripheral extremities, whereas venous insufficiency is associated with poor return of blood to the heart.
Alright, so we know that Marcus is not receiving sufficient blood flow to his legs. What are some of the risk factors that you see? Marcus is a smoker. He has diabetes, hypercholesteremia, and hypertension. You might notice the fine layer of dust on Marcus's medication. He does not control his symptoms very well. Marcus is also obese.
Hey.
Unbeknownst to Marcus, his father also suffered from PVD, and family history is a major risk factor. Now let's look at the symptoms. Marcus has painful cramping in his legs, which is also known as intermittent claudication. His feet are also cold, and if you saw them under the blanket, they would be very pale, and they'll be cool to the touch. Marcus, you're going to want to see a doctor soon.
Where did you come from?
Well, Marcus, I think we've figured out the cause of your leg pain. I'm sorry to have to tell you, but you are suffering from peripheral vascular disease, or PVD.
Peripheral what now?
Peripheral vascular disease. Scar tissue, cholesterol, and fat have accumulated in your arteries, hardening and partially blocking them. We call this buildup atherosclerosis, and it is impeding the blood flow to your extremities. Your muscles need nutrients and oxygen, which are delivered by blood in order to work. And the painful cramping you're getting on exertion is a result of a lack of fuel your legs are getting. Also, you complained of your feet being cold all the time, and poor perfusion, or delivering the oxygen to the tissues of your feet, will result in exactly that. You understand?
So my arteries is clogged, so my blood don't get through, so my muscles don't get fed.
Marcus has demonstrated a rudimentary understanding of his diagnosis. He'll need further education, but this is a good step to understand in treatment of his condition.
Are you kidding me with this woman?
And how did you arrive at Marcus's diagnoses?
The patient presented with cramping in his lower extremities on exertion that are relieved by rest. He stated that it started a few years ago, but he hadn't felt like coming in until it was so bad that he couldn't walk for more than 30 minutes or so before cramping. We started with a review of the patient's history. He told us his father had suffered from leg cramps for years, but was unsure if he'd ever been given a diagnosis regarding it. He is also what we refer to as a 30-pack a year smoker, which puts him at risk for a number of health issues, including PVD. Your refusal to maintain the prescription regimen I've given you is certainly contributing to the occlusion in and damage to your arteries. Yeah, we moved on to a physical assessment of the patient's legs. They were pale in color and cool to the touch, indicating a lack of perfusion. Capillary refill was poor. We noted markedly diminished distal pulses. A Doppler and an ankle brachial index were used to determine the degree of arterial insufficiency, and the results showed it to be fairly moderate. We put the patient on the treadmill for an exercise test, and a drop in the ankle systolic blood pressure after 5 minutes on the treadmill, which is an abnormal finding, indicated that the arterial insufficiency was indeed the most likely cause of Marcus's leg pain.
Fascinating stuff, Doctor. Thanks. Now, let's look at those tests and some others that the doctor might order if Marcus isn't successful in controlling his PVD.
Other tests seen with this condition are duplex ultrasonography, computed tomography or computed tomography angiography, magnetic resonance angiography, air plethysmography. Okay, weird. Anyway, your case seems moderate so far, so I'd like to try a non-pharmacological and non-surgical methods to treat this. An increase in exercise is the best thing that you can do for yourself right now. I'm going to want you to walk as much as you can. And yes, we need to talk about quitting smoking. I know we've talked about it in the past, about your lack of willingness to do this, but we've reached critical mass on this issue. Another thing I can't stress enough is the importance of you taking your insulin, your Lasix, and your Lipitor. I really need to see you start to better control your diabetes, your hypertension, and cholesterol levels. From what you've told me, this also means a serious change to your diet. So there you have it. The pain that you have in your legs it will get worse even at rest as this disease progresses. So if I ask a lot of you, it's only because so much is at stake. Understand?
Yeah, there's a lot of stuff.
Stuff. Great. Okay, well, I'll leave you with Nurse Lucy, and she's got some pamphlets or information or whatever for you. So, all right, I'll see you later. Thanks. Bye.
Okay.
As they're often hurried, doctors sometimes don't have enough time.
Excuse me. Marcus, the office across the hall is a lot more comfortable, and I think I might actually have some practical ways that I can help you out.
A good patient advocate. Every nurse worth his or her salt.
Out to you. Really, out.
So the doctors moved on quickly, and the majority of the care has fallen into the nurses' hands. So, Nurse Lucy, what topics that the doctor brought up have you been over with Marcus since we spoke with you last?
Well, the doctor advised exercise, so Marcus and I have been going over a number of things that he can do and resources to help him increase his exercise level. We've set some short and long-term goals, and depending on how he improves on his own, we've given ourselves a month to determine whether or not we're going to need to discuss with the doctor if he needs a PT regimen. My assessment of Marcus's understanding and readiness to work hard towards improving his fitness has me cautiously optimistic that he can make strides. His doctor and I both understand that Marcus would owe us rather ear on the side of seeing what progress he can make on his own without our direct intervention. Hence, no new prescriptions are needed at this time. Marcus would like to keep it that way.
The patient's right to their own healthcare choices must always be respected. What else, Nurse Lucy?
He's going to be walking as much as he can with the goal of increasing the amount of time that he can keep walking before the onset of pain. We took a baseline time for him, and he's going to begin keeping a journal of how long he's able to walk before the pain sets in. With this information, he'll be able to know how far he can push himself without getting himself into a lot of pain. The doctor also touched on smoking cessation, which is almost never an easy subject to deal with, but a very high priority. Marcus is armed with some information on cessation, including support groups, guided imagery.
You are fishing on a calm pond and the trout are biting. You are at peace.
And coping with addiction. We've also set some goals with him and will reassess periodically over the next few weeks. Marcus is willing to consider over-the-counter cessation aids as well as antidepressants if he is unable to achieve these goals that we've set.
Goals are a very important part of the nursing process. Marcus, what did the doctor say that Nurse Lucy was helpful in understanding?
I'm going to start taking my furosemide, insulin, and atorvastatin right away again. It's been a while, so she reiterated the old teaching, you know, hypoglycemia, postural hypotension, and whatnot. And it made me demonstrate an understanding so she could be sure I knew what I was supposed to do. She does that every step of the way. And then we got to talking about diet, and this is a big one because I love the food that I eat. But she got me to understand some simple dieting concepts, and that should be able to help me eat better. You know, I'd love to lose this gut, but I'm more likely to succeed if I take it, you know, gradual like. So small steps, portion control. Substitution. Measurable weight loss goals. I think that's really all the doctor covered, but she had a bunch more stuff for me.
Of course she does. The doctor has his own diagnoses, but Nurse Lucy has her own nursing diagnoses. Lucy, what is your priority nursing diagnosis for Marcus?
Well, he's got ineffective peripheral tissue perfusion related to compromised circulation as evidenced by claudication, feet that are pale and cool to the touch, and diminished pulses in his lower extremities. We need to increase the arterial blood supply to his extremities, decrease venous congestion, promote vasodilation, and prevent vascular compression.
Serious stuff. We'll come back to that in a minute. So, Nurse Lucy, what are your other diagnoses? What are your goals regarding them, and how will Marcus achieve them?
Marcus is at risk for impaired skin integrity related to compromised circulation. So our goal would be to maintain skin integrity. His feet are in good shape right now, and we want to try to keep them that way. Keep them protected with shoes and socks or thick padded slippers at all times. Meticulous foot hygiene is always important, but he should take care when cutting his nails to not injure himself in any way. Since wounds take longer to heal and can become infected, he has been taught how to perform thorough foot inspections. Furthermore, the better nutritional choices he's pledged to make will help encourage more effective healing. He also has chronic pain related to impaired ability of peripheral vessels to supply tissues with oxygen, as evidenced by reports of pain at 7/10 on exertion. Our goals are pain relief and prevention. The doctor recommended acetaminophen when needed to support activity and tolerance for exercise. And when pain arises, promoting circulation in his legs is also going to be important for pain prevention. I also found Marcus to have deficient knowledge of self-care regarding his various conditions, so I've provided teaching and literature regarding his diagnosis of diabetes, hypertension, hypercholesterolemia, and PVD. He lives with his mother, so next time he's in there to see us, he will bring her along and we can teach her some ways to aid and encourage him. Marcus has had a lot of information thrown at him today, but at every step he's been able to demonstrate understanding of what he's been told, and he's displayed a real enthusiasm for taking better care of himself. So my last diagnosis right now would be readiness for enhanced self-care.
That is fantastic. So, Marcus, back to that priority diagnosis, improving your circulation and perfusion. What have you and Lucy decided to do to achieve your goals?
Well, first of all, I got to control my other conditions. That will help my circulation. And then I got to quit smoking because that impedes it. Lots of walking. Walking a ton, that'll promote blood flow. And I gotta quit smoking because that impedes blood flow. So I also gotta keep my feet warm to prevent vasoconstriction, but I don't want to apply direct heat because that could hurt them. I'm supposed to keep my legs at or below the level of my heart so more blood flows down. I also got to avoid stress or deal with it better. Come on! Oh! Oh. Oh. Because I'm pretty bad at it, and then my sympathetic nervous system starts constricting my vasos. I gotta avoid crossing my legs. Oh, sitting in one position for a long time and wearing constrictive clothing. So a lot to do, but I think I can handle it.
You've got your work cut out for you, but don't forget about the good resources that we've given you. You've clearly paid attention to everything that we've given you today. So now, do you feel like you're ready to put this plan into action?
Yes, ma'am.
I do too. I think we're just about done for now, but do you have any last questions?
No, ma'am.
Thank you both. And good luck, Marcus. That's all the time we have for today. Please tune in next time when we see what Marcus has done to treat his peripheral vascular disease.
On our next episode...
We've taken some liberties for the sake of information and entertainment. But if you or someone you know is attempting to narrate in a hospital setting, please contact your institution's privacy office.